Well, hello, everyone. Thank you so much for joining us today. I'm Tina Freese Decker, President and CEO for Corewell Health, and I'm also the board chair for the American Hospital Association. We know that there are many pressures and challenges facing our hospitals and our health systems, but there's also never been a better time to truly transform how we care for people. I believe that AI and other technology innovations play an important role in this transformation, which is why I'm so excited to explore this topic today. There are so many new capabilities already making their way into our field that are advancing the care we provide and making it better, safer, more accessible for the people that we serve. With so many tools and technologies out there, it can be difficult to really focus on what delivers that value to the patients, to our communities. And so it's incredible that we have this conversation today. That's why I'm so pleased to be joined by Dr. Jackie Gerhart, Chief Medical Officer of Epic, to ensure that we talk about these opportunities for healthcare. In addition to her role at Epic, Jackie is also a practicing family medicine clinician, so she can give her firsthand perspective on how she sees technological advances improving care for her patients. So Jackie, thank you so much for joining us today. We are so appreciative of all you do for Epic, but then also what you do to serve people in your community. And it's been a pleasure knowing you throughout the years in various areas, but it's wonderful to be able to talk to you today.
Yes, thank you.
I wanted to start out with just, a basic question. Tell us what drew you to healthcare, and then your favorite either healthcare or non-healthcare AI technology that you use.
Sure. Well, thanks again for having me. This is really exciting to be able to talk about not only how care is advancing, but also the different technologies that are available to truly do it now. I think one of the things that we often find in healthcare is we, opine or desire to have something soon. And really, we're seeing a lot of people using things. So excited to talk about that. What brought me into healthcare, I grew up in Wisconsin in a small town. And I really found myself enjoying people. In fact, my first word instead of mom was hi. And I felt like I really just loved engaging. And I fell in love with math and science and actually thought I wanted to do engineering. Did biomedical engineering as an undergrad, went to a internship and was making components for G-tubes, and found out that although I loved the science behind it, I didn't get to interact with people and I didn't get to see the end result of the actual product. And so I really, at that point, pivoted into medicine. And I was at University of Wisconsin for undergrad in engineering and neuroscience, then went to Mayo Clinic for medical school. And while there, I had exposure to amazing mentors and a plethora of different opportunities to go into medicine. But I kept finding myself on all my rotations thinking, this is it. This is the best one. This is going to be what I want to do. And then the next one was even better. And the next one was even better. And not only could I not really decide, but also it was the in-between moments that really intrigued me, the in-between what the heart surgeon does, the in-between the visit that you're getting with the specialist, and really how do you care for the whole person. So I wound up in family medicine, which I love. I moved back to Wisconsin, joined faculty at University of Wisconsin, and did 8 years of what I would consider the dream, which is inpatient, outpatient, delivering babies, taking care of people at nursing homes, teaching at a med school, teaching in residency, really doing all of the full spectrum care to the point where I would go into my clinic, and if I didn't look at my schedule beforehand, I could have, my first patient be a newborn I had just delivered, and the second one be someone I had to explain, a difficult cancer diagnosis to, and a third person that was there for sports physical. So just the breadth of it and the ability to have that kind of continuity of care over the lifetime was what really intrigued me. And then for the technology, I'm a big fan of anything that is giving you more information than you otherwise would have had that you actually can be actionable about. Probably the first one that came to me was a smartwatch, being able to understand my exercise habits. I've had smart rings. I've used, of course, all of the new agents and AI tools that allow me to learn faster and really democratize that education, and then also be able to use those to train my patients and help understand really what it is that they want.
That's fantastic. So you're really applying what you're teaching as you move forward. And it sounds like you've had a very rewarding career, and it's not over. You're just at the prime of it. So when you think about the possibilities ahead for us, especially as it relates to technology and all these things that you can learn from, what area do you think we have the greatest potential?
Potential is an interesting term because I think it's kind of two different things. There's the part of it that is the option for transformation, and then there's the part, as you mentioned earlier, that's really practical and being able to be applied now. So I do think that AI, the use of agents, the use of bringing that technology into medicine, both the care of medicine and the transformation of new medicine, is going to be a game changer. Just like the internet was transformational, I think this age of AI and AI agents is also transformational. I think in terms of practical, one of the things we struggle with in healthcare is being able to evaluate different tools, understand, are they going to be useful for our populations? Are they going to be tuned for our specific populations we're caring for? What do we already have? What do we still need to purchase? So I think there's so many pieces out there right now, especially within the AI sphere, to help us answer patient messages as clinicians, to help patients be better informed about their care, to be able to use their patient portal, Epic's is called MyChart, to try to better inform them of what's coming up next. So I think, well, the transformation part is absolutely AI and AI agents in that future. I think just digital health in general, we can't forget that that's something that's already bringing us together with things like telemedicine and care from your phone.
I think that's absolutely correct. That it's the digital piece to this and how we're designing it, and we can't design it based on the paper model into a digital model. It's truly transforming. I also think the key element is we need to be clear about the problem we're trying to solve. There's so many shiny objects that are out there that can distract us, and we must be laser focused on that solution that we're trying to solve. Otherwise, we can get very distracted. So when you think about that, it's we have to evaluate all of these new technologies, this transformation. It's important to evaluate the costs and the benefits of those new innovations. What are some of the criteria that you believe hospitals and health systems should keep in mind when we look at those opportunities? And do you see major barriers when we adopt the new technologies?
Yeah, great question. You hit the nail on the head. It's absolutely, everyone is inundated with new shiny technologies. And I think the very first question, as you put it, is what is our problem that we're trying to solve? And then I think the second is, do we already have technology that could actually be solving this better than we're using it? Is there something in workflow that we're not optimizing? Is it a people or human factors issue and not even a technology issue? So first evaluating what the problem is and then seeing where within the workflow, literally studying how is it that this could either be more efficient or more effective. And then I would say, just like I was talking about before, there's digital health, there's AI. Evaluate if there's already a digital health solution that may be lower cost than the cost and compute of an AI solution, and see also if you already have it. One of the things we notice with hospitals is that they have technology that they've already purchased and they may just not be optimizing it or have even turned it on. One of the hardest things we do at Epic is we create software, and we created a very fast clip trying to keep everyone up to date with the best and greatest. But if they don't turn it on, or if they don't fully optimize it or help train their users, then it really isn't allowing for that technology to get to the point where it's actually being optimized. So after all of those questions, then when you get to the AI question, and in terms of what's cost effective and what's not, oftentimes we see people do one of two things. They'll either kind of do a pilot and then learn if it's the right technology and then try to expand from there. But we've actually found that sometimes some of the greatest technology solutions are caught in this death by pilot cycle, where in reality, if you've seen another organization already do it and you're able to apply those results to your organization, you may not need to do a full randomized controlled trial or a full study of it. Just make sure that it really fits in with your clinicians, your workflow, and your patient population. Be sure to test it locally and understand that it's going to actually be effective, and then go for it and be a little bit bold about this, because this is a technology that's actually really changing and advancing care. And we have the opportunity to have that now.
So, as a physician, I'm curious to know what you've seen over your 8 years really practicing in that area, and maybe even before in your education and training, and what you're excited about coming forward to make it easier. And then any advice you have for us as we implement these things and ensure the whole goal is to make it easier for our physicians and clinicians to provide the care and easier for patients to receive the care. What advice do you have for how we would implement it?
Yeah, great question. So I practiced for about 8 years and then started at Epic, and I've been at Epic for about 8 years. I remember this is, man, probably in maybe 2015 or so, I had a patient who I was doing a physical exam on the exam table in my practice, and I was examining her thyroid, and I felt a small lump on one side. And I wanted to finish her exam, but I also wanted to order a ultrasound and think about a fine needle biopsy, and also see if she had a prior TSH, and all of these different things that were both passive and active. And I felt myself hamstrung to this one point in the exam room thinking, okay, do I turn to the computer? Wouldn't it be great if something could kind of bring this all together, a technology perhaps? And she and I were going back and forth and saying, wouldn't it be nice if I could just say, in this case, I was using Epic. So, hey, Epic, order a TSH and follow up in 2 weeks. And if the TSH is elevated, let's go ahead and do an ultrasound. And then, by the way, record this into my note and also give me some decision support as to, what is going to be covered by her insurance, et cetera. And she was a little bit of a tech nerd, so we geeked out about it for a while. And it really got me thinking, as one of the reasons for me wanting to get into tech is that, yes, I love patient care and I can have such a good impact on the people in front of me. But if there's a way to truly transform medicine to try to make it both easier on clinicians and also more practical for just getting access to care and being able to democratize care, then that's really the secret sauce. So I think, and I think I would use that as my example. We just had our users group meeting, UGM, a few weeks ago, and it was really, I was so thrilled because it was kind of this way that we embodied everything I was hoping for all those years ago. We showed how a patient with their My Chart can go in and actually speak and ask questions to be able to create a patient agenda. So instead of a patient coming in to me and me saying, hey, what brings you in, or what else, and then having my hand on the door and leaving and being like, oh, there's one more thing, I can actually pace the visit by having the patient tell me specifically what it is that they want to accomplish. And then on the clinician side, we have ART, which is the AI for clinicians, and that then in real time can go through the patient agenda and choose each topic. So say the first one's hypertension, it can bring up to me a summary of all of the hypertension information that's in the chart, as well as blood pressure cuff information that they may have from home, and even help me with decision support using real world evidence and actually looking at that person themselves, how old they are, what they've tried before, and help me decide what might be the best course of action for this person with all of the tools that I have in my tool belt. So I think for me, the concept of being able to, of course, still have a screen there where I can reference information, but being able to be like have this literal linear approach between myself and my patient, and then to use something on the side as a guide that's really doing all of the busy work and helping with the friction in the background, I think is really the panacea that I'm hoping for, because I want AI to help me and augment me to be able to have maybe the best doctor I can be. And I think I can even be a better doctor using this technology, both for my patients as well as trying to treat their diseases.
Do you see, I think that's fantastic. Do you see patients readily engaging in this? And do you see the potential for the use of technology and the things that allow us to do like sharing the agenda, changing patient behavior to more healthier behaviors?
Yes. So I think I discussed some stuff in the exam room, and I think that's really important for changing behavior and treatment. But really, again, it's those in-between spaces that actually have the biggest opportunity for changing behavior, I think. And so I've loved how some of the technology we're using, again, going back to just digital health, I was speaking about how wearables can help affect people's behavior. And what's interesting is we have a website called epicresearch.org, where we study different questions of Cosmos, which is a real world evidence platform. And one of the questions I had asked was, in patients that are wearing a prescribed continuous glucose monitor, in those patients, pre-diabetic, just wearing it to try to improve their health, in those patients, does their A1C change? And it turns out over all of those patients, it didn't have a statistically significant change. And that was actually surprising to me because I thought behavior would change enough. But then as I went back, I thought, you know what, I'm asking the wrong question. It's not whether the A1C, which is a measure for diabetes, is really the question. It's how's the rest of their lifestyle? What's their BMI? Are they getting heart disease? How's their hypertension? All of the other things that we need to look at to determine if something is actually changing behavior, because the behavior of change actually might be the thing that we should be measuring. And it brings me to this thought of, traditionally in medicine, we've thought of things like labs or treatments or medications, and it's very much been sort of like a medication focused career. And I really think we have the opportunity now to further expand that into a person-focused career and really have it be, you tell me what it is that you're coming in for. Maybe it's you just want to make it down the aisle, and so I need to help you with your knee pain. Maybe it's not that I need to, fix what is on my agenda, but it's actually what's on your agenda.
That's fantastic. That's really good. And so we have the patient behavior change that you've talked about. And as we want to implement all of these in our hospitals and health systems and physician practices, what advice do you have for, accepting these changes? This is change, and the new technologies and that mindset that you have of AI can help me be better. What advice do you have for us, especially working with physicians and clinicians?
My first piece of advice would be open to change and really embrace it as it can be uncomfortable, but it might actually be the best thing for you and your care in the long run. Way back when we were first thinking about speech to text for notes, not even AI at all, I was a pretty good user of the EHR. I used my templates, and I would often write my notes over lunch, and I would take a bite of food, and then I would type, and then I'd take another bite of food. And the thought of me having to dictate my notes was like, well, how am I going to eat my lunch? And finally, I did it a couple times, and I saw we have a tool called Signal, which shows you how much time you're spending in different parts of the chart. And I saw that I was being more efficient. And I was actually surprised and a little bit like, oh man, I thought I was pretty good at this, but I guess another technology can actually help. So I switched. And it made a difference for me. It made a difference for my patients. I felt like I was being able to get into the exam room on time, get home for dinner more quickly. And so it was just a change of behavior. And for physicians specifically, a note is a great example. We are used to, we learn in medical school to do this elaborate, long history and physical and really sort of pour our hearts out in this like epic story of the patient. And I think now that we have technology that actually is listening to the story of the patient, we can capture that story without necessarily having that be something that's burdensome on the clinician. And so I think rethinking what it is to be a physician, and this goes beyond into AI as well. Like, what do we learn in medical school that actually makes us a physician? What actually is top of license? And what does a license mean now that maybe memorizing the Krebs cycle isn't the first thing on your list, but figuring out how to work with AI and transform medicine is actually what we should be learning?
Wow. Very good philosophical questions that we're going to have to be navigating right now. And it's critical as we transform the field and what we do and better serve the people in our community. So thank you for that. I want to ask you one question about our partnership between EPIC and the American Hospital Association. So we've recently partnered together. Can you tell us a little bit about the new maternal health tools and how they will help our patients and providers?
Yes, and thank you for the collaboration. It's been such a joy to be able to work together. As I mentioned earlier, I have a heart for rural health. And as I delivered many babies in my past, I noticed that oftentimes in the moments that we actually need information, sometimes it's difficult to get, especially if, and in this particular situation, we focused on postpartum hemorrhage. And so, especially in a situation that truly could be life or death, having it so that I can think and focus on the patient in front of me, but have all of the other things happen in the background, almost as a checklist, really helps to make sure that I'm able to provide the care that I need. So that's literally what it is. It's taking existing technology, putting it together, and then encouraging healthcare organizations to adopt it. So just like we were saying with AI, the technology is only as good if you actually are implementing it. So there are 5 pieces to the postpartum hemorrhage toolkit. And within these pieces, there are things that maybe the organization or the rural health hospital just hasn't turned on yet. It's really simple. It's making sure that you're calculating the qualitative blood loss correctly. It's making sure that you have protocols in place for the right treatments. So we call them smart sets or order sets, but really making sure that it's all teed up such if you need to actually go ahead and treat, that is something that can be done really quickly. Then it's making sure that before a postpartum hemorrhage happens, that we're able to actually predict. So using predictive tools where the chart can actually flag you to say this woman is at an increased risk of postpartum hemorrhage, be sure that not only the typical tools that you have are available, but you're also thinking about this throughout your process. And then after the delivery, it allows us to do some analytics. So the idea is we can continue to monitor the woman and see how it is that her treatment is affecting her care. And then even once she's left the hospital, to continue to monitor things like blood pressure and really population health to make sure that this is not happening routinely at different healthcare organizations, and that the metrics, the outcomes that we're looking for. And by the way, we're in the process of phase 2, which is us scaling this out to multiple different orgs. So trying to give them the opportunity to implement it, which is pretty easy. But then again, the human change of being able to say, okay, we now have these tools that are going to help us. Let's use those. The goal is to try to decrease the number of postpartum hemorrhages at each hospital that adopts this over the next 6 to 12 months. And then to learn from the champions, there's some that are already implementing it, to learn from those champions what worked, what didn't work, not just for implementing the actual tech, but for what did you do at the bedside that allowed this to be effective. And I've been so lucky to work with Chris DeRienzo. What's great is I did the delivery side and he's done the pediatric side. And so we both have been virtually in the same room at the same time, caring for the same issue of postpartum hemorrhage. And just we've both had patients pass away from this. And so the impact that we've seen and the ability to actually do something practical, that's not just, pie in the sky, say that we're working together, but really actually change a patient outcome, I think is important.
This is a great example of identifying the problem that we want to solve and figuring out a solution for it. And it's wonderful to have that partnership to be able to do that. So thank you for that.
Thank
so
you.
I'm going to close today with just asking you about what you're most excited about when it comes to innovation and transformation.
I'll go second. Why don't you tell me what you think you're most excited about?
Oh, I love it how you're turning over to me. I'm really excited about the potential that we can create. Yeah, I think that there's so much opportunity for harnessing some of the new technologies and artificial intelligence, but really seeing the impact to patients. I was just talking to some of our teams the other day and hearing about the amazing progress we've had. When you talk about surgery, when you talk about the research elements, and we're just at the cusp. I mean, you feel like you've made so much progress, but there's so much more that we can do, and that's what gets me excited. And really, the impact is back to patient care. I was just rounding and met one of our patients, and he had an essential tremor, and he couldn't sign his name for 30 years. And so we did a focused ultrasound procedure where we, have the laser focus as part of the brain, heated up to 58 degrees Celsius, which is like 130 plus degrees Fahrenheit. And after the procedure, he could draw a straight line. He could sign his name, and he sent us a handwritten note, 2-page handwritten note that he wasn't able to do before, detailing his gratitude and how he can now hold a cup of coffee and drink from it. So that is the incredible piece that I see, why I'm in healthcare and what I'm so excited about, to see the progress that we can make and the impact we can have on people.
I love that story. That's beautiful. I completely agree. It centers around the patient. In addition to specific patient care, I'm thinking also about sort of the broad population health and what can this do to advance medicine. And I think as clinicians, we tend to think about the information that we put into a record or the information we gather, and we see that as part of the healthcare visit, but then it's kind of put into the background. And I really think that data isn't the exhaust of healthcare, but instead it needs to be the fuel for personalized medicine. And as we start to learn from these journeys, and AI can learn from these journeys more quickly than humans can, we actually can figure out how to personalize medicine, advance new cures, figure out how to research things more quickly, and hopefully get that out to people so that one of the things people have is they're curious. They want to know what's going on and how it can be be fixed or helped. And I think as that curiosity grows, we have more and more tools to help inform and democratize data for patients and also inform personalized care.
Our health is an everyday, every minute sort of thing. It's not just one time a year when you're with your doctor. So I think it's really important that we connect all of that data and we give people the tools that they need so that they can reach their health outcomes and their goals that they want to achieve. So, Jackie, thank you so much for your time today, for sharing your insights and expertise, for caring for our communities, and for being so active and a supporter with EPIC and partnering with the American Hospital Association.
Yes, thank you. It's been a joy. Thank you so much.
And thank you to all of our viewers for finding the time to tune in. We will be back next month for another Leadership Dialogue conversation. Have a wonderful day.